After the closure of Rock Prairie Behavioral Health, the Brazos Valley has been without an acute residential psychiatric hospital since this summer, putting a huge strain on mental health resources locally.
It was a major hit, and it also increased our level of effort in that those individuals who used to can be just driven over to Rock Prairie or walk over to Rock Prairie or whatever, now those individuals we were now getting involved in terms of evaluating and help facilitating hospitalizations.
As a result of the lack of a regional psychiatric hospital, individuals are needing to be transported to the surrounding metropolitan areas in order to receive the proper care.
Even had to solicit family members to transport some of those individuals who were voluntary and not meeting criteria for involuntary.
In 2019, the Sheriff's Office transported 767 people in crisis to a hospital. Of those, 521 people went to Rock Prairie. Now the Brazos County Sheriff's Office transports patients to Houston and Austin.
The closure of the Rock Prairie facility means that the 500 or so people that were taken there for civil commitments now have to be taken to facilities in some cases 2 hours away.
According to researchers, on a state level, over half of Texas counties have 0 psychiatrists or psychologists, and 2/3 of all licensed psychologists live in only 5 Texas counties. Texas also ranked in the bottom 3 states in mental health spending, leading to question if the state just doesn't care about mental health.
That it's not a Texas issue, it's just a human issue that we tend to put a higher value on physical health and mental health and kind of forget that in a lot of ways, mental health is physical health.
While fixing the need for mental health resources won't happen overnight, the Brazos Valley Economic Development Corporation, along with local leaders, are working to increase local mental health resources, hoping to find a company to operate an acute residential behavioral health hospital in the Brazos Valley.
Well, over the last month, we've seen some momentum. Our state representatives and local county leaders are working together to try and identify someone to come into the community and provide those essential services.
The cost to bring another psychiatric hospital is one that will take a company to really see the need for care. But for many who are in crisis, the cost of help is priceless. Reporting in Bryan, Hallie Jones, 25 News.